Hello and welcome. Today, we'll be discussing a potentially uncomfortable and serious topic, urethral foreign bodies. We'll explore what they are, how they happen, the signs and symptoms to look out for, how they're diagnosed and treated, and what you can do to prevent them. So, what exactly causes a foreign object to end up in the urethra? Urethral foreign bodies occur when an object is intentionally or unintentionally inserted into the urethra. In adults, this is most often related to sexual exploration or autoerotic behavior. Psychiatric disorders, intoxication, and seeking attention can also be factors. In children, curiosity and exploration are the most common causes, with small objects like beads, crayons, or toys being inserted. Accidental insertion can also happen following trauma or during medical procedures like catheterization if instruments break or are inadvertently left behind. The pathophysiology of urethral foreign bodies is pretty straightforward. The presence of a foreign object irritates and damages the urethral lining. This leads to inflammation, swelling, and potentially ulceration. The object can obstruct urine flow, causing urinary retention and increasing pressure in the bladder and kidneys. Prolonged obstruction can result in bladder damage, kidney damage, and even infection. The risk of infection is increased by the presence of the foreign body, which acts as a nidus for bacterial growth. Epidemiologically, urethral foreign bodies are relatively uncommon, but the true incidence is difficult to determine as many cases go unreported due to embarrassment. They are more frequent in males due to their longer urethra. Cases tend to be bimodal, occurring in both young children and adults. Among adults, there's often a correlation with underlying psychiatric conditions, substance abuse, or sexual experimentation. The signs and symptoms of urethral foreign bodies can vary depending on the size, shape, and location of the object, as well as the duration of its presence. Common symptoms include difficulty urinating, a weak urine stream, urinary frequency or urgency, lower abdominal or pelvic pain, blood in the urine's hematuria, and urethral discharge. Some individuals may also experience pain or discomfort in the penis or perineum. In some cases, if the object is lodged high up, flank pain might be present due to backflow of urine into the kidney. Diagnosis typically begins with a thorough medical history and physical examination. The physician will ask about the circumstances surrounding the event and carefully examine the external genitalia. Imaging studies are crucial. An X-ray can often identify radiopaque objects, such as metal or bone. A cystourethroskopy, which involves inserting a small camera into the urethra, allows direct visualization of the foreign body and helps determine its location and size. Sometimes, a CT scan or ultrasound might be needed for more complex cases or to rule out complications. While urethral foreign bodies aren't typically classified into rigid types, the nature of the object encountered can be categorized. Objects can be rigid or flexible, sharp or blunt, organic or inorganic, and small or large. The categorization of what type of object is present can help to determine the plan for removal. Treatment focuses on safely removing the foreign body while minimizing further damage to the urethra. The specific approach depends on the object's size, shape, location, and the length of time it's been in place. Small, easily accessible objects may be removed in the office setting using special instruments under local anesthesia. Cystourethroskopy is often used to visualize and grasp the object for removal. In more complex cases, surgery may be required, either through an open incision or a minimally invasive approach. Following removal, a urinary catheter may be placed to allow the urethra to heal. Antibiotics are usually prescribed to prevent or treat infection. Psychological evaluation may be necessary for individuals with underlying psychiatric or behavioral issues. Preventing urethral foreign bodies involves a few key strategies. In children, it's important to keep small objects out of reach and educate them about the dangers of inserting objects into their bodies. For adults, open communication with partners about safe sexual practices and avoiding the use of foreign objects for stimulation can help. Addressing underlying psychiatric conditions or substance abuse problems is also crucial. The prognosis for urethral foreign bodies is generally good if the object is removed promptly and without complications. However, delayed diagnosis or traumatic removal can lead to urethral strictures, urinary incontinence, erectile dysfunction, or even kidney damage. Recent research is focused on developing less invasive techniques for foreign body removal and improving long-term outcomes. Ongoing studies also investigate the psychological factors associated with intentional foreign body insertion, with the aim of developing more effective prevention and intervention strategies.